of Coffee Chat. So, welcome to another third Wednesday of true goodness and, a really, really sweet event. My name is Nurse Dexter, and I'll be your host today. Ladies and gentlemen, it is my pleasure to introduce to you our esteemed speaker, Mr. Maher Kharma, an occupational therapist with over 25 years of invaluable experience. So, just imagine that experience being shared to you live. Anyway, so Mr. Maher is a graduate with both master's and doctoral degrees in occupational therapy, having dedicated his career to neurological, orthopedic, and geriatric rehabilitation. And as an adjunct professor, he has shared his expertise with future professionals, mentoring graduate students in various healthcare settings. So, Mr. Maher's approach is grounded in knowledge, certifications, and years of direct clinical care, covering a spectrum of medical conditions. So in 2009, he founded Masa Medical LLC, where he currently serves as a consultant in the area of aging in place. And that's what we're going to be talking about today. So without further ado, let's give a warm welcome to Mr. Maher Karma, whose insights are sure to enrich our understanding of creating accessible and safe living spaces for us and for our elders. Good morning, Mr. Maher.
Good morning. Good morning. I am so excited to be here. Thank you for having me again. And thank you for everybody who's attending this morning. I know it's a cold morning, and surely we're going to make it a warm one because we're going to be talking about making home more homey and accessible, safe, and more pleasant for all of us. So thank you, Dexter, for the kind presentation. And, I think when I last edited that intro about myself, it was a couple of years ago. So now I have to add that my experience is over 25 years. But, if that's going to make me look younger, let's keep it at 25 and we'll go from there. So, yes, I've been basically working in the clinic and providing clinical intervention to individuals with different kind of medical issues and disabilities, you name it, stroke, multiple sclerosis, orthopedic injuries, post-surgical care, amputations over, since end of the 90s. And then over the last 10 years, a transition to working and consulting for different programs, where I would actually go to someone's home and find out what are the barriers, what are the challenges that someone's having. And, our challenges vary depending on our abilities and limitations and, medical conditions. So then after which, I would tell them, what I think needs to be done to make the home safer and more accessible. So that's in a nutshell what we're going to be talking about. So we're going to dig deep into the presentation. I hope that, everybody will be leaving today having learned about different risk factors, about falls. Falls is a big thing. We'll be talking about that. We'll be talking about the barriers that people experience at home, how, we assess home safety, and, talk about adaptive equipment technologies and modifications that are out there. So, in good days, our homes are, a place that we love and we cherish. We love our privacy. We love our spaces. And, in good days, those spaces are, safe, accessible, and easy for us to navigate. Now, the environment does not change, but we do change. And, our vision changes, our reflexes changes, our hearing, our mobility, our flexibility, our even mental processing all change. And that's where the challenges start building up. We, may end up investing in a house with large stairs, not knowing that down the road, stairs might be a challenge, bigger spaces might be a challenge, bathtubs may be a challenge. So, that's when reality sets. So people start having accidents at home. And falls is one of the biggest problems that we have nationwide. And I'm not here to be an alarmist or to scare you, but it just happens. It just, and there are two reasons, two like categories to why people end up falling at home. And before I dig into that, I can tell you that last year I took a good fall simply because my toddler decided to spill her bubble, water on the stairs. So I did not see that she has the bubble, the soap on the stairs. So I walked down the first, like maybe 5 steps, and I slid down the last five because she decided to sit me up. And it was remarkable that I did not break anything, but I was bruised and sore for about 3 or 4 weeks after that. So, you don't know what may cause a fall, but, our muscle strength changes, our balance change. We may experience dizziness, and that's associated with taking more than 4 medications. Our reflexes change. It just, happens with age. It just, it's something that, your reflexes at age, 70 is not what they used to be at age 25. The environment, and that's what we're going to be talking about, how to address the environment. You can have slippery surfaces, loose cords across the room. The lighting is a problem. If we can't see our way, especially when people wake up at night, not being very steady and want to go to the bathroom and don't have sufficient lighting, that poses a great risk of fall. Broken steps, improper use of assistive devices. The doctor or the therapist may recommend that you use a cane, but you don't feel up to it. Lack of bathroom equipment, and then lack of stair handrails, and then obstacles. And of course, I was telling Barbara that I've been doing this work for over 10 years, and I yet, to get to the bottom of it in terms of learning about barriers, because everybody's barriers can be different. And, again, depends on your abilities and limitations. So you may have issues with, the pet running around. You may have problems with, that you can't hear the alarm. You can't hear the, when someone rings the bell. It depends. It depends on the challenge that you're having. It could be physical, it could be sensory, it could be, some other related issue. So falls in numbers, 1 in 4 older adults fall, and the chance of falling increases after the first fall. Less than 50% of people report that to the doctor. They feel like, what, yeah, it just happened. I didn't know I was cooking, and I just turned around and I fell down. It was okay, nothing happened. They don't think much about it. In my mind, fall is a syndrome because it does not happen just like that. It happens because of some underlying issues, just like any other medical condition. And I don't think we do a good job as healthcare providers addressing it and finding the problems that has led to that fall. The injury, of course, it's very costly economically and to the person. There's a high rate of people who never return home after a fall, especially if the fall was bad, if they have experienced concussion or broke a hip or an ankle or wrist. So that's why it's very important for us to start it before it happens. Where do falls happen? Surprisingly, mostly they happen at home. They don't happen in the park or in the mall. They happen at home because we take things for granted in the area that we have lived in the longest, and we feel like, you know what? Yeah, I know my way around. And I remember that, a couple of years ago, I was talking to my dad, who's now 96, about installing sensor lights in the front porch because he goes out and it's dark. And I mean, I could not see the steps. And he's like, we've been here for a long time and I know where I'm going. And, I really don't see why we need sensor lights. But, I mean, I feel like, safe better than sorry. Why didn't you do that and start from before it happens? Because you know that your abilities are going to change. You're not going to be as steady. Maybe you had that thorag one day and it did not do anything bad to you, but now your gait and your balance is not as good as it used to be 5 years ago. So if you lose your footing, you may not be able to get your balance back and steady yourself. And that's when people end up falling, being like risk takers. If you see the picture on the very far on the right, showing the lady in the kitchen, that's another common problem where people, use unsteady step stools, either next to the bed or in the kitchen, and that's how accidents happen. Clutter is a big problem, and if you don't keep your house, tidy and the house maybe unkempt, that causes a problem. So a lot of things that need to be addressed, and it's a project. And I'm hoping that when we're done today, that you will be taking a moment to rethink about your goals for your well-being and how you want to make your home that you've lived in and enjoyed a safer place. So reality sets in, we fall, and I visited a lady last week, and her grandson told me that she falls about 3 or 4 times a week. She has decreased mental ability, and the family, are unable to keep an eye on her. Now they installed surveillance cameras to keep an eye on her. And I mean, certainly they don't want to confine her to the bed. So there are like bed sensors that will alert the family if she starts getting out of the bed. She has very limited mobility. So she forgets that she cannot stand. She forgets that she has bad balance. So now the family, are trying to find alternatives to how they can keep her safe. She used to get in the bathtub, but now she's not. So we looked at replacing the tub with a walk-in shower and, getting her a recliner chair so she can be more comfortable, because now she spends a lot of her time in a small transport wheelchair. So again, you have to look at, how you can make the environment conducive for you, not, thinking that, yeah, I'm gonna restore my memory. I mean, unfortunately, yeah, we want to get better, but if you have, someone who has dementia or has bad arthritis, those issues are gonna keep getting in the way and a compromise in the function and the ability to be safe. So home becomes a threat, and whether you have to deal with this, the bathtub, the stairs, the kitchen, and people start having a challenge. Uh, to us, home is a very special place, and we want to stay at home. And we'll talk about the concept of aging in place. I mean, it's people want to stay at home, the home that maybe you raise your children in. We spend a lot of time. We remodeled. We had all our social events. We spent, ions of moments, in the evening, just watching TV and sipping on our drink and being comfortable, and maybe our children even graduated and get married and left this home, so there are a lot of memories attached to our homes. uh, and when we are able to function in our environment, that promotes our independence and promotes our self-esteem. And the opposite is what happens when we're not able to access the various parts of our home, that compromise our independence and takes away from self-esteem. I visited families where the individual that I visited is confined to their ground floor level of the house, because they can't navigate the stairs. They can't go upstairs. They can't go downstairs. And the family has moved the bed into the family room, and they have a bedside commode next to them, and or they have devoted the dining room as a family, as a bedroom for that individual. So a lot of changes happen, and you can just think about the impact on the family and on that individual, feeling like, "Oh, why do I have to do this now? I took their dining room away from them. I don't have my privacy." So it just gets to be a very weird situation and scenario for everybody, including the individual who's being cared for. Uh, People have moved away from wanting to move from their home and downsize because they want to stay in the home that they love. They want to stay close to their hairstylist. They want to stay close to their dentist. They want to be, in the neighborhood that they have been acquainted with and spent a lot of time at. They're worried about the moving expenses, and they're worried about what do I do with all the belongings and knickknacks and all the small items, and who's going to do this and how, and do I trust the people, and on and on. So people just don't want to go that route as much as they did 20 years ago. So in the 90s, the aging in place concept was coined, and CDC, Center for Disease Control and Prevention, identifies or defines aging in place as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. And that's what we try to do, is find how can you age in place, and look at all the components that affecting your abilities and the limitations that you have, and find out how we can provide you solutions. Of course, the cost of aging in place versus moving to a long-term facility is a fraction. I mean, I'll share some projected cost to modifying your home to make it a home to your liking versus moving to a long-term facility where you are going to end up spending every last penny staying in a place that you don't belong at. So if you decide to modify your home and make it more accessible, functional, safer, there's these are some projected costs. There's the assessment cost that roughly sits at 450. That's, when you have specialists coming out, surveying your home, taking measurements, taking pictures, interviewing you or the individual at concern, finding out the areas of challenge, finding out, what really goes on and why the area is challenging, and looking at your goals. Yeah, I would like to be able to access my deck, but I can't because there are two steps. I would like to get in the bathtub, but I can't. So that's where the examiner or the specialist would assess all these areas. If you are to install a RAM, RAMs can be very different in cost. Of course, there are different types of RAMs. They can be, if you're just looking for a threshold RAM to be placed at the door, it could be like maybe $150. But if you're looking at like 20 feet RAM, the cost can be much higher. There are the wooden and then the aluminum RAMs. Grab bars, they are a must. If you're going to walk out of this presentation, not remember anything, remember that you have to have grab bars in your bathroom. And the suction grab bars don't count. They are not safe. Bathroom modifications, to convert the tub into a walk-in shower, the cost can be, as little as 3,500. But if you're going to go with like porcelain tile and, be fancy and all, the glass doors and on, the cost can be much higher. Door widening for someone who's using, let's say, a rollator or a wheelchair in their home can go up to 1,200 because you have, the contractor has to cut into the drywall, relocate electrical outlets, and then install a new door and hardware. Of course, there's an easier solution to that I'll talk about. Some people are looking at installing elevators in their homes, so that's another option. Of course, the cost goes up. Sorry. What are the various approaches employed to address environmental challenges? So if I come and speak with you and you tell me, yeah, I'm having, these challenges. So in my mind, there are four dimensions that I would have to help you out. I would look at, modifications that includes grab bars, replacing the tub with a rolling shower, and on and on. Technologies, like, okay, what about installing motion sensors, raised toilet seats, rollators, equipment that can help the individual. And the rollators have gotten a lot of popularity over the years because they can be, the ones that will help you access the community, and you can have a seat with you whenever you need to walk and take a break, especially if you have shortness of breath or fatigue issues, fibromyalgia, multiple sclerosis, or some other medical conditions. Behavioral modifications, going back to that lady who was standing on the step stool, it's very important for us to change our behavior and learn that, what, we're not the same. We don't have the same faculties that we used to have. So we have to be more conservative and careful about how we, go about, our behaviors and activities. And lastly, environmental reorganization. So do I need to declutter? Do I need to relocate so maybe my sink is next to the stove. So if I'm making some pasta, I have the pot, filled the sink, and then I can slide it to the stove next to the sink. Do I need, to have like maybe a cart on wheels to help me to take my meals to the family room? Just, changing how we go about things. The aging in place process has gained popularity based on AARP and CDC. Over 80% of older Americans indicate that they wish to stay at home. So the going to a nursing home and long-term facility and assisted living facility has gotten to be an old trend. And, now people find that actually I can stay home, but I just have to make some changes. So home modifications, this is where it starts. You start thinking about, okay, so I need to make my home safer and a better place for me. So you start, thinking about this process. So you think about the entries, you think about let's say the bathroom, family room, every area that you may have a challenge at. And when I go and assess someone's environment, I'm like, okay, so let's start from the door that you use to access the outdoors. Which door do you go through? I look at how many steps there are. Typically, if they have like a couple of steps, we can talk about hand railings or even a foldable ramp that can be removed when it's not needed. We look at, the entry, we can look at the stairs, the bathroom, bedroom, basement, basement door, and bedroom. And then, we look at, what needs to be done. So I will be, focused in today's presentation mostly on the bathroom and on the stairs because are probably the most challenging areas and the ones that typically lead to the highest number of falls. And hopefully in a future meeting, we can talk about other areas. We do, I start with a function evaluation. I want to see, how do you go about, your bathing system? Like, even if someone is bedridden, there are some systems now that, can be available for them. Do you have problems with the tremor? Do you, like, when you feed yourself, like there are, special equipment for someone who has Parkinson's. Do you smell your food? So, we can talk about divided or partition plates. Do you have problems with seeing things? So you can talk about, vision-related issues and magnifying, a magnifier. Do you have problems with managing your medications or even reading the labels on your can? There are, tools that are available to read the print on the can for you, and on and on. Do you have problems with the toilet hygiene? Maybe you can talk about the toilet seat bidet. So I learn about the functional issues, And then we start talking about, the medical history. What is it that you have? Yeah, I have dizziness. I have some vision issues. I have incontinence. I had a stroke, so I can only use one side of my body. Uh, I look at, what equipment they have. So tell me what you have: a wheelchair, scooter, rollator, bedside commode, shower chair, grab bars, handheld shower hose. Uh, how do you walk? How far can you walk? And how steady are you? What equipment do you have to complete your dressing and bathing? Who's available to help you? Do you have a home health aide? And so we look at all that stuff, and then we take the tour. We take a lot of measurements for the doors, for the toilet, for even the bed if the bed is too high and is a concern. Uh, then the process goes from identifying the barriers. Okay, yeah, you can't get into the bed, so you're using a step stool. You can't get into the tub safely, and you have fallen in the tub. Then we look at how mobile is that person, what kind of medical issues are posing challenges. That's how I start looking at, okay, so if you are having problems getting in your bathtub and you feel like you have to stand on one foot, maybe you should consider a shower bench. And I'll have a picture of the shower bench that I'll show you in a minute. If you're having problems with the stairs, you either need to look at installing a hand railing or a stair glider or stair lift. If you're having problem with the outdoor steps and you're using the scooter or a wheelchair, we have to look at either a permanent or a portable ramp. Uh, we look at all of that. We make the recommendations, and the program that I work with is called the Medicaid Waiver Program. I'll have some information about that at the end and some other funding resources I want to share with you. I send my recommendations to the program, and they will, review my recommendations and then send wherever I recommended or modifications within reason, send them to the individual. They will have, contractors to work with them and install whatever they need or modify whatever they need. So the areas, again, at concern can be entrances, stairs, bathrooms, doors, kitchens, and bedrooms. Uh, we have to go by, looking at Americans for Disability Act as our guidelines. But again, ADA applies to public facilities. It does not apply to your home. What applies to your home is aging in place, because I could say that, yeah, for you to have an accessible bathroom, the bathroom it has to have at least like 5 by 5 feet. But we know that if you look at our powder rooms, they're probably like most of the time they're 3 by 4. So I make, I use whatever is available and make it better, make it more conducive for you. I have several scenarios where the individual, is residing at the home. They have very limited mobility. They cannot navigate the stairs and they don't have the resources to go up the stairs to the full bathroom. So actually there's a portable bathroom that we can provide them that looks like, a little tent. It's called a shower bay that I don't think I have a picture of it. I'll see if I do. But that's like a shower that can be placed next to their bedroom, let's say in the family room, where they can take a shower sitting in a chair. They'll have two hoses. One hose will be providing the water supply. The other one will be pumping the water out. I mean, I'm just sharing that as an example that there are a lot of technologies and a lot of options, and there's always a solution. So the challenges that people face with getting in and out of the house, of course, can be very serious, and you have to look at what do we do to be able to get in and out of the house. A lot of people, for instance, are spending time on their own, and they don't have the ability to go out and unlock the door even when their caregivers have arrived. So a keypad has gotten to be very popular, and the ring alarm or bell has gotten to be popular. So you can check for safety purposes and independence, you can check who's at the door, and then you can lock and unlock the door from your smartphone. Again, for stairs, you have to look at solutions. Again, I'm not going to spend much time on this. You could look at whether you need hand railing. That's the least costly expense or solution. You can look at ramps. You can look at stair lifts. Stair lifts have gotten very popular. And the stair lift, if you look at straight stair lift, the cost can be about $4,500. If you have curved stairs, those for sure are fancier, but the cost can be about 17 or 18,000, unfortunately, because it has to be basically customized to those exact stairs that you have. And there are the walker stairs that's shown on this side, a little bit costly. Ramps, this is the wooden ramp. This is a nice option, except that, in about 5 years, you'd have to stain and restain and worry about termites. The modular ramps are more popular now. They are less costly as well than the wooden one. Okay, we are going to move forward. So the doors, what I shared initially, that there is an easier, or I'm sorry, less costly solution. This is called the offset swing away door hinge. If you replace your standard door hinges with those offset hinges, your cost would be no more than $200 for the door versus $1,200 for replacing the whole door. This will give you the ability to increase the door clearance by 2 inches. And that will make a big difference most of the time, whether you are using a walker or a wheelchair. That might be all what you need to do. Now, of course, if you're looking at the narrow powder room doors that are typically 22 inches, that's not going to cut it if you are trying to get in the powder room using a walker. And that's when you need to widen the door. But, if you look at the bedroom doors, kitchen doors typically are about 26 inches. So if you add another 2 inches, that will do it. If you are going to go by ADA requires that all doors should be 36 inches. But again, the offset hinges can provide you a great and costly solution. The stairs, my least favorite area, because that's when people experience the biggest problems. The stairs deteriorate. The stairs, lead to a lot of falls. And, it could be just because they have loose carpet runners, or because they don't have enough lighting, or because the stairs are waxed, or they don't have hand railing. A lot of problems. So the stairs is an area of big concern, and it has to be addressed. So to address that, again, the easiest solution is to install, if you are mobile, to install hand railings. That will give you solutions. You could add treads to the stairs. That will give you a lot of stability and enhance the safety of those stairs. If you are someone who has impaired balance, but you're able to walk, the stair lift or stair glide would be your next option. If you are wheelchair bound, you'd have to look at the wheelchair platform lift. Those are, more expensive, of course, but, you don't have to transfer. You go from, let's say, the basement, you ride on that lift all the way to the top floor, and you don't have to get out of the chair. You're sitting in your wheelchair, versus with the stair lift, you're required to get off and, transfer to the landing or to the level that you have arrived at. The kitchens, another area of concern, of course. We can talk, for a couple of hours about the kitchens, but, if you talk about wheelchair accessible kitchens, you want to have adjustable counters, you want to have accessible microwaves, you want to have accessible sinks, and you have to have clearance for the wheelchair. So that's in a nutshell what we need to look at. There are the drop-down shelves that you can actually pull down, so you can bring the plates down to you. So pull-down shelves have gotten popular over the years. The bathroom is the biggest area that people struggle in. So the bathroom has three items, and I'm gonna move a little bit faster. We have the bathtub, we have the sink, and we have the toilet. So in order to make the bathroom accessible, we recommend that you get the wall-mounted sink so that we can roll underneath it. Those are the probably most problematic tubs because they're very high, even for someone who is mobile and active. So to make the bathroom accessible and safer, you have to have grab bars, you have to have skid-proof floor, secure bath mats, you have to have a shower chair or a bench. I'll show you the pictures. You have to check the lighting. You want to have definitely handheld shower hose and a raised toilet seat. This is a raised toilet seat. This enhances the height of the toilet. Most of our toilets are 15 inches, and that's not very comfortable. It can be low. With something like this, it comes at times with a knob, locking knob. You increase the height, so you don't have to replace the whole toilet, and then you have the arms. For the shower, this is what, these are some options for making the tub more accessible and safer. You could completely rip the tub, get out all the tub, inserts, and then you create a shower, a walk-in shower. This is looking like what a bath fitter looks like. You get an acrylic shower that's basically glued to the walls, and you have a little strip here called collapsible dam to stop the water from seeping out. So you can just walk in or roll using a rolling shower chair. So of course there are rolling shower chairs. You can roll yourself or get rolled in, and then you can wash yourself, and then you can dry yourself, and on and on. If you want to keep the tub cut has gotten popular over the years. The cost of this process, replacing the tub with a walk-in shower, roughly can be $10,000. The tub cut can be about $4,000. Basically, what we do is we cut the tub, and you can actually reverse this process. But that way, you have an easy way to get in. You have grab bars, you have a shower chair. And if you decide one day that, no, you know what, I'm fine, we can actually get the piece that was cut back in place, and you have your tub back. The shower bench is another nice option. I recommend it a lot. Basically, part of it will be sitting outside the tub, and the other part will be inside. You sit on the edge, and then you slide. And now they even come with like a sliding chair that will help you slide over. Very important to take a close look at your bathtub and bathroom and see, how do you keep yourself safe there. Some of the commonly recommended equipment would be the handheld shower hose. Those can be bought at Home Depot or Lowe's for almost like $40. They make a big difference. The non-skid mat, you can get it at Walmart for about $20, or you can put safety treads. This is a shower chair. If you're able to step over the tub or have a walk-in shower ready, this would be a great idea for you to get seated, eliminate dizziness. Grab bars have to be screwed to the wall, not suction cup. And this is the top bench that I spoke about, so you can sit at the edge and then slide over. Bedroom, there are different equipment for the bedroom. The recliner lift chair has gotten popular over the years. We're not going to talk much about that. Mobility equipment, of course, this is my friendly rollator. I recommend it frequently to people. Lightweight transport wheelchair. This weighs about 16 pounds, easy for the caregiver to put it in the trunk, especially if they're taking their beloved to a doctor's appointment out to the park, to the mall. And for motorized scooters, they are very helpful for someone who wants their independence and have the ability, the cognitive and the visual ability to operate it. Uh, okay, so let's see what we have here. One thing actually that I wanted to talk about that, the artificial intelligence and smart uh, products have gotten very popular over the last 5 years in the market. So this is like the Ring uh, doorbell kind of a thing. You can operate your door keypad from your smartphone. So this is very nice, and those keypads can be, bought at Amazon for less than $100. Uh, if someone has like memory issues and you're worried about them going out their door sensors, you can get like 4 of those at Amazon for about $20. The alarm will go off if they're trying to walk out on their own in the middle of the night. There are uh, sensors that will sound off if that person started wandering at night. So you can plug those on the house, and they are battery operated, so you don't even to have an electric outlet. Of course, the surveillance camera can be another option. This is the bed alarm. So if that individual starts getting out of the bed, you are alerted that mom is on the move, so you can, so at least you have gotten some sleep before she or he has done that. Uh, Alexa and Amazon Echo, have gotten very popular because now you can have smart outlets. You can basically plug an outlet to your existing electrical outlets, but those smart outlets would allow you to control your small appliances. You can, just say, hey Echo, hey Google, turn off my radio. Hey Google, turn on my light. It's funny as I'm saying that my phone is responding to me now, so it's funny. Uh, but you can do something like that, and have better control over your environment. So you don't have to wait for people to do that. Hey Google, turn my lights off, something like that. Some people are investing in robotics for companionship and for keep an eye on them and on and on. Of course, there's the Lifeline. This is an emergency service that I highly recommend that you invest in. It comes in the form of a bracelet or a necklace, and it's attached or connected to a monitoring company. So if someone, let's say, if mom is living home by herself and she, God forbid, falls in the bathroom and she doesn't have access to her cell phone, she can push the button and they will contact her and see if she's okay or if she needs help. So that's a great service that you should look into. Now, one of the most important things that we need to wrap up with is funding resources. Again, I think one of the popular programs that has gotten very popular and was started over the last 15 years or so ago in different states is the Medicaid waiver program. And the waiver program has different waivers. So there's like what's called autism waiver, there's the brain injury waiver, there's the community first choice waiver, and on and on. So this is, what you have to do. It is income based. So it's not based on the family's income or on your son's income. It's based on your income. You could not be making more than $2,000 a month or so. This is the phone number for you to call the Department of Health in Baltimore and start the intake process. And I have a warning for you that you may have to call them several times. This is a very, very, very popular program. A lot of people want to get on this program, and that's one of the biggest programs that I work with. So once you get in this program, I mean, if you want to learn more about this program, we don't have the time to dig deep into it, but they can provide you a home health aide who can provide you help. Some people, get supplies if you need, uh, something like diapers or some other supplies. Some people get meals on wheels through this program. And through this program, you get someone like myself to come out and provide the evaluation, something that's called environmental assessment. And they provide each individual, a qualified, eligible individual, $15,000 to put my recommendations in place. So my role is to tell the state that Miss Smith needs a stair lift, she needs a ramp, and she needs her tub replaced with a walk-in shower, after which the state will say, okay, we're going to send a contractor to do what, Maher asked us to do. Medicare Advantage plans, I know, a lot of people are moving towards the Medicare Advantage plans. There is part of the policy that they pay some for the modifications, not tons. Medicare, straight Medicare does not pay anything, unfortunately. I'm talking about Medicare Advantage plans. Long-term care insurances can provide some help in this process. Of course, if someone has been injured at work, workers' compensation will provide them all what they need as part of the settlement. Condition specific grants. If you have, condition like spinal cord, DLS, MS, disease, the associations have grants that they will support home modifications. If you live in Montgomery County or Howard County, their Department of Health has programs and grants for people for modifications. And there are some nonprofits such as Habitat for Humanity, Independence Now, and Rebuilding Together that will give you what you want based on your needs and based on the grants that they have. And we're done.
All right. Thank you very much, Maher, for that very, very, you know, useful, practical, and beautiful presentation. And for those who are watching, you guys, I'm gonna be leaving the information if just in case you wanted to get in touch with our expert panelists, you will be able to do so. I'm leaving the information here, okay, in the chat. Anyway, if you have any questions, guys, now is the time to leave them, to tell our panelist what you have in mind. Is there anything you want him to know or anything? So we have a few messages here. Thank you. Maher has great ideas. Okay. All right. So I'll just be leaving the contact here. Also, we'll be leaving the contact information of Visiting Angels, and we will be inviting you for the upcoming event this coming January 17, again on a third Wednesday, and it's gonna be about everyday money management secrets. Okay, so you can register as early as now. So here, if you live on a steep hill, how do you get recycle and trash to street level? That's from Susan.
I'm actually looking at the questions. Let me make sure I am reading the
Oh, from the
question right.
top. All
Okay,
right,
if
let's.
you live in a high rise, right? Is that what you are looking at,
Yeah,
Dexter?
that's another question. We could start with that. If you live in a high-rise condo, how do you get groceries up to your condo?
So, I mean, the options that come up is either that you have to have one of those rolling carts that people would use to put your groceries, and basically you can push it or pull it. That would be one option. Of course, if you are using a scooter or a wheelchair, there are different kind of baskets that are available depending on the scooter or wheelchair that you use, or bags. So the other option, of course, there are delivery services that you can invest in. So that would be another way for you to look at. Of course, those come with a cost. But again, if you are mobile, you just walk to the store, come back, you'd want to have one of those rolling carts with you so you can put all your groceries in them and just push them and take them up to your apartment or condo. Will this entire presentation be available this over? I believe Dexter will make it available.
Yes, we will make this available along with any handouts that Maher will be providing for you guys. We will be attaching them for you.
So Susan is asking if you are living on a steep hill. I'm just like, I'm having the shivers reading that, Susan. Okay. How do you get recycle and trash to the street level? Uh, I mean, you're talking about steep. A steep is a steep. So, I mean, that's where you start thinking, okay, so number one, is it safe for me to continue taking the trash or recycle out to the street level? What happens on an icy day? So you have to be worried about that. Uh, and you have to think, okay, do I need, for instance, to install like a hand railing for me to hold into as I'm dragging my recycle bin down? Uh, do I need to, look at the type of shoes that I'm having? Do I need to make sure that uh, I create, I don't know, I have to look at the environment that you are in. So I have to create maybe a little, storage unit out if possible, if homeowner association allows you, and on, where I keep my recycle and trash bins closer to the street where the trash truck will pick them up. So, uh, so you can look at, what you can wear, what you can install. Uh, Believe it or not, some people in where in states where it's terribly cold, like in Michigan and Alaska, they have invested in warmers for their driveways. So because they're going to have ice or snow good part of the year, so they know that those heating systems will not allow the driveway to freeze. So in your case, you have to look at, okay, so I have the weight of the recycle bin and the trash bin that they're going to push me down, and I'm on a steepy hill. Do I need? I mean, I'm thinking, do you need to install a ramp for that? I don't think that it looks like you're mobile, and that's going to be a big expense. So that's why I'm thinking that you probably need to look at, can I store the recycle bin closer to the street, and what do I wear shoe like proper
Maher,
shoes or boots? Yes, ma'am.
Maher, I have got a question, and I actually have seen this before. There was a question. I used to work for UPS many years ago, and people were wondering about getting their packages. Is there anything mechanically that could be put on, where you're setting something where you can mechanically take and turn a switch on and move it up? Like you're doing sometimes you've gone up a stair ramp. Could there be
Yeah.
something that could take it up a hill mechanically that if the recycle bin was sitting there, she could put her items in, and then could there be something that could transport it up to the top of the driveway and bring it down?
So, Barb, I'm sure there is. Again, I
I'm
told
just
you
thinking
that
outside the box. Yeah.
I will never say that I have seen it all. So uh, it depends on, honestly, I mean, there probably is something like that. I'm not aware of that. It looks like, a mechanical like system, assembly line kind of a system that will have to be installed. At that point, when you research the cost, Susan's going to have to look at, is that something that I want to do, or do I need to like look at my location,
Mm-hmm.
and on and on. But so the answer to your question, Barb, is that I'm sure there is such a system. I can tell you that, just knowing that, let's say a stair lift, can be 20K. A system like that, would be probably pricey. I don't have a tag number, uh, but uh, you know, uh, she has to look at, her priorities and, what she can afford and her goals. Uh, all right. Let's see. Can you ask the recycle people to come up to the top of the hill and get trash? I have seen neighbors do that. I mean, certainly. I mean, if you are not able to do it, I think, I started thinking like, can you hire someone? Or if you cut a deal with those, guys, I mean, I think I value our trash truck people and our cycle more than many others because they're invaluable. So I think, if you like tell them, okay, I can't do that, I'm this and that, can I pay you like $5 a week to do that? So I think, on the long term, that might be a great solution. There you go. Karen has a great idea. The neighborhood teenagers are always looking for ways to earn money. I absolutely dig in, the network, see, who might be able to do that. But, you have to think about your safety and think that in a, taking a fall over one of those steep, driveways with the weight of the recycle bin can be a serious problem.
All right. So looks like we have our questions answered. And Barbara mentioned here, that yes, visiting angels can actually be of service to you for these kinds of taskings and activities of daily living. Anyway, we have 3 minutes more. If you have final questions, let us know. And if you don't, I would like to thank everybody for joining us today for this insightful coffee chat webinar on home modifications, of course, with Maher. Thank you very much, sir, for sharing your expertise with us. It's been a true pleasure for me, and I hope for everybody. Also, so for everybody, we appreciate your engagement, your questions during this session. We understand that, time is valuable, so we are thrilled to announce that a replay of this session is gonna be sent, of course, to you in about a day. Of course, I'll just be editing things so that it's clean once it gets to your inbox, and we'll be asking for handouts from Mr. Maher Kharma as well. And don't forget, I'll be putting his contact information again, visiting Angel's contact information again, and don't forget to mark our calendars for our next episode coming this January 17, again on a third Wednesday. And then it's a truly exciting topic as well. Everyday money management secrets revealed. Okay, so before we part ways, let me extend a warm wishes to everyone. For those who are celebrating Christmas, Merry Christmas to you, Happy Holidays, Happy New Year to everyone. May it bring you health, happiness, and new beginnings. And lastly, if you like this episode, please do share your feedback. I've left the link as well in the comment box. So that's it. Looks like we don't have any more questions. We got 2 minutes more. If you have final words, Maher, Barbara, stage is yours.
I wish you the same great holiday season, peaceful, happy, warm, and for all of you to put some of the consideration in practice, and hopefully the next year will be a great year for everyone.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights. See you again next third Wednesday of the month.